Well, friends, welcome to today's session, and we have Professor Tamkeen Khan from the Department of OBGYN at GN Medical College, AMU Aligarh, which happens to be my alma mater also. She is a famous fellow from CMC Ludhiana. A very, you can see the number of degrees, DNB, MNA, MS, MI, COG, well traveled around the world, right up to the Sloan Kettering Hospital, and she'll be taking the educational goals and learning objectives and overview. You will the vibrations of enthusiasm from her will reach all of you all over India. Over to you.
Thank you so much, Professor Sanjay. And thank you for taking this initiative and for joining us all over India together, all obstetricians and gynecologists. And I really thank you for including me as a faculty. I have no conflict of interest, except that I want to dedicate this presentation to Professor Vinay Kumar and Professor Tejinder Singh, because it is based on very useful, very important, priceless inputs from both these people, Professor Vinay Kumar of Robbins Pathology fame and Professor Tejinder Singh from CMC Ludhiana. And he was our mentor at FAMER Fellowship, during FAMER Fellowship. So again, I want to thank Dr. Sanjay once more, because he initiated this discussion on MEU India group, a month-long discussion where Dr. Vinay, Dr. Tejinder Singh, and many people from all over India participated, and this resulted in a publication of this paper, and most of the presentation is based upon this paper. Now, before I begin about answering this question, I would just like to tell you a little joke, a very sweet little joke. Why CBME? It will answer that question. A school teacher was trying to explain to a kindergarten class the meaning of the word accident. And she was trying to give a lot of examples and trying to explain the meaning. And after she was satisfied she had done her job, she asked the whole class, "Dear students, if on Monday morning I'm trying to cross the road across the school and I'm run over by a bus, what will you call that?" The whole class answered in unison, "Monday holiday." So you understand the need of competency-based medical education. When our objectives, our goals, and the goals of the students do not match, or they are vague, or they are intangible, or they are not well defined, this is the result of the whole process of education. Again, if I tell you that this is how I'm going to do the session today and tell you about these small parts that I have divided the whole session into. And if I tell you this, by the end of the session today, participants will be able to compare educational goals and instructional objectives, explain the significance of learning objectives, classify learning objectives, discuss the advantages and disadvantages, and explain the role of learning objectives in constructive alignment. So you see the difference? What idea does this give you, this lesson plan? Hardly any. It just lists the content that is going to be discussed, isn't it? And this tells you what exactly you will be able to achieve by the end of the session, hopefully. So we'll take a minute, and I hope you have downloaded that guided notes paper that I sent you today. Think about what are educational goals and try to answer that question. What are learning objectives? What are they designed to achieve? And why, I have divided the whole session into small parts, and I'm asking more questions from you rather than answering for them, because I need a lot of inputs, because I need experience sharing from you all, and I want to have a much richer experience by the end of this session. So what are educational goals? You can put your hand up and Dr. Sanjay will unmute you, and you can organize your thoughts in that small guided notes paper and then answer. You want to answer these questions, please? Yeah.
Hello, Dr. Tamkin. I have also joined. Welcome all the participants and profusely sorry for being late.
Yeah, we were missing you. So you can just put your hand up and Dr. Sanjay will unmute you. So we can all help each other answer. Whatever is coming into your mind, you can do that. No definition, I'd like to say, is perfect. So anybody would like to answer that question?
Dr. Archana Sinha.
Yes, Dr. Archana.
Please unmute yourself.
Good evening, respected senior faculty members. I'm Dr. Archana. Very nice to be part of this program. So, madam, according to me, educational goal is a broad term. Like maybe it will take a long time, and objectives are short term.
Yeah.
As far as I think, for end of the lecture, that is the objective of a particular lecture, but the long-term goal, like 4 or 5 years, what we expect of our students, that is a broader term.
Yeah. Anybody else would like to add to it?
Dr. Anjali.
Yes. Welcome, Dr. Anjali.
Anjali Kanhere.
Welcome to the webinar. You've been entered as an attendee in listen-only mode.
Okay, Dr. Sabita has also raised her hands. Please unmute yourself. Dr. Vaibhav Kanti. There is a red button there. You have to unmute.
Hello.
Yeah.
Hello.
yes.
Ma'am, very much thank you for making me part of this. For according to me, it is developing our having some knowledge and developing our skill, and letting our students to develop so much so that they can actually perform the skills on real patients. So that is our main goal.
Yeah. Okay.
If
So
I can add now, am I audible?
Yeah. Yeah.
Yes. Yes.
Okay.
Actually, learning objective is a very brief statement. What the student has to learn.
Okay.
Hello?
Yeah.
Yes. So it should be a very precise thing. What you want the student to learn out of the whole system or out of the whole lesson. It should be very clear.
Yes, absolutely. So these two figures, these two pictures may help you organize your thoughts better. And anybody else would like to answer? No.
Hello. Hello.
Yeah.
Hemant
Hello.
Damle is also there.
Hello.
Yes.
Yeah.
Yes,
Hello.
please speak.
Am I audible, madam?
Yeah, Bilkul. Yeah.
Yes.
Good evening, ma'am. Good evening, everyone. And I feel that educational goals is at the end what the student is achieving.
So that is the most important, absolutely right, that we should be able to know what the student is actually achieving, is actually competent enough to be able to be allowed to practice medicine, isn't it? So let's go into the CBME definitions again. Goal is a global statement about the projected outcomes of the course, providing overall direction and vision. It does not give the details of the actual student performances or how you're going to measure them. Whereas when you talk about competency-based education, you say that competency is a general statement detailing the desired knowledge, skills, and most important, the attitude of the students graduating from a course or program. In other words, what should have changed in the learner by the end of the course. And when you talk about objective, competency is a broad term. And when you break that whole competency into small tasks, exact tasks, measurable tasks, you call them objectives. So learning objectives are specific, measurable targets that describe what the learner will be able to do after successful completion of a course. They are learner-oriented and stated in terms of the learner behavior. And that is why we call it a learner-centered education. And in other words, as the booklet says, what objectives tell us what the Indian medical graduate should know, do, or behave. And like somebody added now, competent is a person when the student demonstrates the synthesis and internalization of psychomotor skills and professional attitudes into a seamless routine to perform a task. So can you identify whether the following statement is a goal or an objective? To be able to discuss the pathogenesis of elevated blood pressure in the context of placental dysfunction in pregnancy-induced hypertension. Is that a goal or an objective?
It's a goal. It's a goal.
Is it?
It's an objective.
Because it is a small part, isn't it? And very definite to be able to discuss. Whereas the second, the student should be able to.
Second one is the goal.
Goal, yes.
Second one is
Because
the goal.
it is intangible. So I thought I should not be using this table, but I'm glad I made this table. Somebody already told us the differences. Goals are broad statements, projected intentions, whereas objectives are specific, precise, targeted within the general goal. These are longer, these are time-bound, these are intangible, these are tangible. You can measure them. They are abstract, vague. Objectives have to be very concrete. These are hard to measure. These are measurable and observable. That is also very important. So I hope we will remember that. Now, what are the advantages of having learning objectives? Okay, to give you a hint, you can divide into objectives for the teacher and objectives, sorry, the advantages for the teacher and the advantages for the student. Take some time to think. We are waiting for your inputs. What are the advantages of having learning objectives? You remember those, you know, I gave you some hint here. Just think about these two photographs, very important.
The teacher,
yes.
The teacher will know the time frame, what she has to teach.
Yeah.
She can be more specific about the topic and then must know subject she needs time frame.
Very good. Please introduce yourself also, just as your name at least. Yeah, I know online is so.
The teacher can make a lesson plan very easily.
Very good. So remove all that curricular baseline. Yeah.
A teacher can make understand students the topic in a particular time frame.
Yes, definitely. So you have learning objectives according to the professional that the student is in, isn't it? The hierarchy.
Yes, according to the Miller's pyramid, it should be framed.
Okay. What about the student? Advantage for the student?
The student will also know what he or she is going to get out of that particular lecture, and in future it will help them to probably prepare for the exam or to really derive what they want to learn from that particular lesson.
May I know your name, please? Excellent inputs.
This is Anjali Kanhere from Bhopal.
Okay. So the advantages for the teacher, any teacher is able to communicate through LOs to his colleagues, to the students, to the public, and because you must be seeing, isn't it, when you take a lecture on maybe face presentation for an undergraduate or a brief presentation for an undergraduate, one teacher will go and will talk about Jatuchni and Ross scoring system. Another will go and just say, no, this is not important for you. just should know how to conduct uncomplicated breech delivery. So with the help of learning objectives, you communicate very clearly with your colleagues, with your students, with the public, and any other stakeholder, the intent and the purpose of an instructional program in a consistent, orderly, and efficient manner. LOs clarify if the task is a knowledge to be gained, a skill to be acquired, or an attitude to be developed. The student and the teacher are thus able to work in concert to achieve the intended objective. Then they emphasize major points. They focus on must-know areas, like you already said. And then they help the teacher to stick to allotted time, help in lesson planning, and remove curricular obesity. They help in selection of appropriate teaching learning methods and materials. And they also help in selection of valid assessment and evaluation methods. So these are also, when they are clear, they may be used to hold teachers accountable for what their students have been able to learn or what they have not been able to learn. By keeping track of the LOs and the student from feedback, teachers have an opportunity to review the objectives and the teaching learning methods for future improvement. They could be useful for accreditation, as well as they help in standardization of education at the international level. They make your course global, isn't it? Now, what are the advantages to the students? Remember, when you entered as a first-year undergraduate, your own time, it was something like this. You had no direction. You was utterly confused. So learning objectives communicate very clearly to the students what is expected of them. They assist students to organize their learning around an unambiguous curriculum with a clear-cut road map. The other day in the introductory lecture, Dr. Damle was talking about having the MCI having a student booklet as well for orienting to the CBME. So that is how it is going to help, having a booklet and clearly stating to them the objectives. They establish relevance of what is taught and learned, which will again motivate the student further because he knows this was supposed to be learned and he's acquired that. If it is correctly aligned with assessment, they will allow students to anticipate test items. And that is how you make, because it is assessment basically which is going to drive their learning. So when you clearly say that this is a must-know area, this is what you should master, they can anticipate the test items. And the another advantage of this is that the student will not leave the must-know area unattended, unlearned. Students understand the link between expectations and grading. A bridge of trust develops, creating an atmosphere of cooperation rather than confrontation with the teachers. So these were the advantages of having learning objectives, and why so much stress is being put on, delivering the learning objectives properly and rolling it out all over India. Now, I would like you to read this sentence very carefully and comment on it. Learning objectives are viewed as an attack on the liberal concept of education, stifling and suppressing creativity, especially in the context of higher education. So what do you think about this? Do you agree with this statement?
It is limiting the critical student. Whatever the objective is covered in the class, we confine to that objective and stop thinking higher than that. I feel so.
Do you agree with
Stop the critical.
So I'm glad so many of us are thinking
Disadvantage.
that way.
Those who are not speaking, yourself. Those who are not speaking, self-mute yourself. Disturbance coming. Otherwise, I will have to mute everyone.
So those,
yes, please,
when you
now speak.
Yeah, the higher order of thinking and the creativity, I think, gets suppressed when we frame certain objectives. May they focus only on these objectives because the assessment is going to be on these objectives, and the self-directed learning, all that gets suppressed, I feel.
You're absolutely right, and I'm glad that people are thinking in this way, and when they are thinking in this way, the quality of learning objectives will definitely improve. We will see as we move along with more discussion during the session. So is competency-based learning in medical education more important even at the expense of suppressing creativity? Like someone said, I have to call you someone because you people don't just a small request, please let us know your name also. So
I'm Dr. Malti from Hyderabad.
Okay,
I'm Dr. Malti from Hyderabad, MEUINDIA Medical College. Yeah.
Okay. So is it more important to have a competency-based learning in medical education, even at the expense of suppressing creativity? Because we are having learning objectives, and by that we are ensuring that the person is competent enough to be able to practice medicine, isn't it? So is it more important, or yeah?
It is important to have competency based learning because the intellectual of all students cannot be same, and what we want an Indian medical graduate to be developed from each batch. Each student should be an Indian medical graduate, and the people who will be having more intellectual, they can have self-directed learning on their own at other times also. That is what is my opinion, ma'am. This is Dr. Sonia.
Okay, thank you, Dr. Sonia. So you're absolutely right. It is essential, it is imperative that the student should be able to achieve a certain level of competence before he's allowed to practice. Absolutely right. But we don't also want to, suppress the creativity.
This is Dr. Madhav Prasad.
Students who have a higher intellectual ability, isn't it? And we also want to develop that intellectual ability in each and every student. So is it possible to make this argument against learning of redundant? Let's see how we can make this important against learning objectives redundant. In other words, what can be the disadvantages of learning objectives? People who oppose learning objectives, they raise two important types of objections, practical or technical objections, and another is basic conceptual or philosophical objections, which Dr. Malti just said. So the formulation and implementation, the technical objectives, they say that the formulation and implementation of the learning objectives for all domains of learning is not possible. The entire focus of objectives is on the premise that you can put everything into observable, measurable behavior. So yes, if you talk about CPR or basic life support, we can measure it, isn't it? If the student is doing this. Okay, then what about professionalism, ethics, empathy? Almost impossible to define and equally difficult to assess. When you cannot explicitly describe something, you cannot objectively assess. Thus, you reduce the educational value of learning objectives. And those who have philosophical objections, they say that higher education, you cannot constrict or restrict it to just a series of learning objectives, which inhibit and stifle creativity, like you all agreed. So the answer is that framing learning objectives which provide a direction to the student but allow creativity is a challenging task, but it is not impossible. A student who knows the path is far more likely to be creative than the one who's confused, since he does not know where to go. Just see these examples. List the hormones that are produced in the ovaries during a menstrual cycle. Simple, isn't it? The student just is at the lowest level of the Bloom's taxonomy, isn't it? Now there's another learning objective. The student should be able to deduce the morphological changes in the endometrium resulting from the hormones produced in the ovaries after ovulation. So isn't it going to a higher level of thinking and doing and applying knowledge? And then lastly, this is, thanks to Dr. Vinay Kumar. He's such a wizard. He helped me design this one. On the basis of the actions of the hormones produced after ovulation, the student should be able to predict the class of drugs and agents that are likely to have therapeutic value in abnormal uterine bleeding from endometrial hyperplasia. Isn't it making the student think, creative, applying all his knowledge, all his skills, isn't it? So the answer is to have more carefully designed learning objectives. These arguments become redundant if we take care to include learning objectives from higher levels of Bloom's taxonomy and from all through 3 domains of learning. How do you determine the goals and objectives for a particular course? Well, the backward planning curriculum is the most accepted and considered to be a better way of planning any curriculum. And it makes perfect sense to start off where you want to end up. So that is where you start off, you design backwards, and you deliver forwards. So it starts with the end in mind by first identifying the desired outcomes or learning objectives for a course. This is where you start. You then create appropriate assessments based on the desired learning outcomes. And finally, you design activities that promote those learning outcomes. And that is how we are going to do in these discussions every session. We are going to design the learning objectives to discuss the appropriate teaching learning activities and the assessment that we are going to apply to that. Then how do you determine the goals and objectives? You study the morbidity and mortality statistics of a country or region. For example, for us, eclampsia, hemorrhage, anemia would be the must-know areas. So that is how we determine, isn't it? Then the job analysis. So maybe PID is not a life-threatening mortality cause for mortality, but 20% or 30% patients in the OPD, they will come with pelvic inflammatory disease. So it becomes a must-know area for us. Then the referral patterns and the critical incidence method. For example, something happens with triggers or when the disease is such that the case fatality rate is rare, but the case fatality rate is very high. For example, amniotic fluid embolism, or something happens with triggers that it is important, like the sexual the rape and the domestic violence, which are now becoming more important and are going to be included in learning objectives. So you all know that the types of learning, it has 3 domains: a cognitive domain, the affective domain, and the psychomotor domain. We all know that, but just to revise everything before we start the actual making of the learning objectives, so that everybody is on the same page. And then whenever we talk about the domains of learning, we cannot forget Benjamin Bloom, who described the hierarchy of learning, the different, there's different levels of learning and understanding in the Bloom's taxonomy in 1956. And he also described the domains of learning as well as the different levels of learning as the student progresses in the cognitive domain. It helps us write learning objectives as it provides a ready-made structure and list of verbs. And that is why when you start writing the learning objectives, you should be very clear about the 3 domains. You should be very clear about what methods, what tools we are using to write those objectives. And that is why for the cognitive domain, we should know the Bloom's model. He proposed that knowing is composed of 6 successive levels arranged in a hierarchy. He looked on learning as a process. We build our former learning to develop more complex levels of understanding, from the simple recall of facts at the lowest level up to the evaluation, which is the highest level of learning. Okay, so this is the pyramid. The student starts with remember, understand, apply, analyze, evaluate, create. So the verbs are there, and what you have to do is you have to think of having learning objectives which are more towards the 1, 2, 3, 4 here, the upper 4 levels, rather than these and these. But these are also sometimes important. Okay. Now for writing the objectives related to the psychomotor, and then the student understands how, and then shows how, and then is able to finally perform. So this Miller's model is used for when designing learning objectives in the psychomotor domain. And lastly, the Krathwohl's pyramid of learning is used for writing objectives in the affective domain. We should all be familiar with it to be able to write relevant learning objectives and which promote deeper learning and higher learning in our students. Okay, then we come to some examples of affective domain. During an encounter with a stimulated patient seeking medical termination of pregnancy for a chromosomal anomaly, the student will demonstrate the ability to pay attention, listen with respect, and make empathetic responses to the patient's statements, reflecting emotions such as anger, communication or video on communication skills on PNDT Act, the student will demonstrate the ability to effectively counsel. Now he's actually doing it, agenda and station in a similar trainer. It is not important of some for thought for you. I taught Stripe how to whistle. I don't hear him whistling. I said I taught him. I don't say he learned it. So it is not always that we have thought of competency-based education, we have thought of learning objectives, we have designed perfect learning objectives. But again, we find that the students are not learning. So what is missing here? What is missing here, we should understand is that, would anybody like to tell us the message of the cartoon? Would anyone like to tell us the message of the cartoon? How far is this true for our educational system?
Yeah, teaching.
Do you think if you
teaching is
do you think if you are
teaching is not equal to learning.
Very good, excellent. May I know your name,
teaching
please?
Is equal to, Dr. Malti.
Okay, Dr. Malki again. Okay, thank you. What else can fail the system in spite of having excellent learning objectives, well made, of every order, in every domain? Okay. So what is important? Somebody already said, Dr. Malti, that it should be linked, the objective should be linked to instruction. But it is also very important to link them to assessment. And that is why this pyramid is so important. If the program objectives, the course objectives, the assessments, the teaching strategies, they are going all in different directions, everything will be out of alignment. And again, the whole program is going to fail. And it has to be something like this. Everything has to be in alignment, and then it becomes a constructive alignment or the golden triangle, and then only your strategy is going to be successful. So what are the steps of constructed alignment? You develop clearly defined learning objectives. You design a curriculum teaching learning activities and opportunities to achieve those objectives. Design an assessment process matched to the learning objectives, and then you reevaluate and modify the program after feedback, after reflection, everything. So just 1 or 2 questions, you can just either type or you can just put your hand up. We're going to play fastest finger first, and I'll tell you why. I'm not checking your knowledge. Okay. So in the cognitive, So in the cognitive domain, which level would be considered by Bloom as being at the lowest level? Anybody?
Knowledge.
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 Ma'am,
Very
knowledge.
good. Okay. Okay.
Knowledge.
So which one of the following statements is not a good objective? And I'm not checking your knowledge, please. Yeah. Or whether my lecture has gone down or not. Well, with you all now.
Understand six good practice principles. B. Understand six good practice principles.
Very good.
Second
Yeah.
one.
Understand. So I told you good objectives should be measurable. They should not be intangible. Is it, how do you know whether the student has understood or not? Isn't it? So now the next
Yes,
and
ma'am.
one more. Last question. Is the following statement a smart objective? At the end of the session, the learner will know the difference between learning objectives and educational goals.
Yes, ma'am.
Is it a
Yes.
smart objective?
Yes, ma'am. It is a
Yes.
smart object.
Why?
It is
Why?
a smart.
It is a smart object.
See here, no, will know. No, the verb I used. Just see the
Acha.
verb.
No,
How
no will
you
be
know?
the basic level, so it will not a smart. It is not measurable.
No. And here, how will you know? The learning objective that you give to the student should be measurable, isn't it? How will you know that
It
the
is
learner
not.
knows? Yeah. So that is why this was, I was not testing anybody's knowledge. I was just telling you how difficult it is to write good objectives, because the next session we are going to devote wholly to writing of the actual writing of the objectives. So this was just preparation for the next session. Okay. Okay. Now we move on to this paper. Sorry. Yes.
Can we the previous one? Can we? Is this the way we need to write? I just wanted to ask you whether the student
So
should
we
be
are going
able
to
to.
talk about how to write. Yeah.
The learner should be able.
Should be
The
able
learner
to
should be
list. Able to, if you want to improve it, it should be at the end of the session, the learner should be able to list the differences between learning objectives and educational, or rather it is even better to say list the 5 differences or the differences. Okay. So it becomes
there is
assessment
another
becomes so
word
easy.
here. Dr. Tamkin, can I come in?
Sure.
Another word, as Dr. Tamkin said, list is a very good word. The another word can be enumerate. Enumerate the differences between learning objectives, and in the enumerate, as they say, as the session will progress, you will understand the degree of knowing. So you can say 10. So if enumerate 10 differences, or if you want to assess the student just on 5 differences, you can say enumerate 5 differences. That will be a better word than knowing, because you cannot judge knowing. You have to have a specific measure to be able to judge the know part of it. So either list or enumerate the differences between so and so would be a much smarter objective.
Okay, Dr. Sanjay, it's saying that you have closed my webcam. Is it so? No. Okay.
Is that clear?
So this was just, it's just, yeah.
I had closed your webcam because your net was becoming slow and your voice was becoming low.
Okay, that's fine. Okay. So
is that no part of it clear? Is that no part of it clear? Madam, whoever asked the question, is the no part of it clear? We have to change the no to list or enumerate. Is that part clear, please? List or enumerate.
So these 3 questions were basically, I was building up for the next class, and we are going to talk about how to write smart objectives in the next session. Okay. Now we come back to the paper, and I love this heading here. Perfect is the enemy of good. So we are going to try and do our best. We know we cannot write perfect learning objectives, but with effort, with time, and with the knowledge, we can try to, and with experience and practice, we can write much better objectives. So the conclusions, I just want to say this story, this is again Professor Tajinder saying, would you tell me please which way I ought to go from here? Asked Alice. That depends upon a good deal on where you want to go, said the cat. I don't much care where, said Alice. Then it doesn't matter which way you go. So if you don't care, it doesn't matter. But if you care, it means you should be able to write good learning objectives and implement the whole thing. Then if you do not know where you're going, you might land up anywhere else and you may even not know what is happening to you. And lastly, I end with a quote from Debbie Desjardins. She's a Femarian and educationist. The most important purpose of an objective is that it should help students to think about what they should be able to do at the end of a learning encounter, and whether they remember the encounter because of something they felt while learning the subject. Meeting a student where he or she is and then walking with them on the journey. From there is walking the journey is the real challenge for us as teachers. All students will perceive whether the teacher genuinely believes in the importance of each objective and will carry with him or her his weight of meaning, which means that if we are not convinced, we cannot convince our students. So in order to convince ourselves, that is why I took it just an overview of objectives today, and then we will move on to the actual job of making them. Thank you very much. And now Dr. Suchi will take over and will make you familiar with the MCI documents. The second part of the lecture, Suchi will take over. Dr. Suchi.
Yes, it was a very, ma'am made such a complex topic so easy with so many lucid examples, and it was really very nice to hear from ma'am. So the next part of the session, I will take you in brief through the MCI document, and so this session is just a brief introduction to the MCI competency-based document, which has been rolled by MCI in 2018, and this document is freely available on MCI website and it can be very well downloaded from there. This document exists and has been rolled out by MCI in 3 volumes. As you can see, volume 1, volume 2 and volume 3. And it is this volume 3 which contains which has the final phase subjects and includes obstetrics and gynecology, which is the focus of our discussion today. So we will be taking you through a brief journey through the volume 3. So when you open this volume, you download this volume, and when you open this volume, at the starting, the content list that is described in the volume is given in the beginning, and it begins with the preamble, that is
the screen.
So
change the screen. We are seeing webcam of Dr. Tamkin.
Acha, okay, sir.
Screen.
Okay, sir. Just
hold on, yeah.
Is it visible?
We were able to see your screen, but now I'm not able to see. I can.
Just a sec, sir.
Okay.
Okay. Can you just, oh, again, it's gone.
It's gone. Just a sec, ma'am. Okay.
Yeah, now it's come back.
Yeah. Now we are able to see it. Yes.
Shuchi, can you just go back to your slides? I think because they were not able to see.
Yes.
And it's very important that everybody should be familiar with the document.
Acha. Okay, so just to go through the document, as you can see, it begins with a preamble, which gives an introduction to the importance of the competency-based medical education that we have been hearing through in our first session also. Then it guides us how to use this manual, which has been extensively brought about the various competencies and the different subject, how to go about it, and then various definitions that are used in the manual, they have been described to ease the understanding of this manual. Then we come to the very important part of the document, that is where they have listed the subject-based competencies of the various subjects. And obstetric and gynecology competencies are given from page 102 onwards.
Shuchi, is it only for me the screen is not moving, or everybody? The screen is moving, the slides are
okay. No, the screen is not moving. The screen is not moving.
Switch off your webcam.
This is Dr. Amita. This is, yeah, now it moved. Now it moved.
Is it okay?
Yes.
You click on the arrow.
Yes.
Shuchi, you use the arrow on the PowerPoint.
Yes, ma'am, I'm using. So after the list of contents, the document, it is divided into 3 sections. Section 1 basically deals with the global competencies that have been extracted from our GMER regulation 2018. And as we know that global competencies are identified as defining the roles of IMG, the Indian medical graduate, and these are the broad competencies that we expect the learner to aspire to achieve. And it also focuses on teacher and curriculum, what teacher and curriculum planner must ensure, and that they have to design the learning methods and assessment which has to be in align to the competencies described in this manual. So as we all are aware about the role of IMG, and that he has to be a clinician, communicator, leader, lifelong learner, and professional. So a small mnemonic C2L2P. Now, very importantly, as we move on, we scroll through the document, we come to the section 2. In section 2, it has very well elicited the subject-wise outcome and competencies has been listed. So when we come to Obs and Gynae section, we can see that these subject-wise outcome, or so-called sub-competencies, they have been organized in a table format. And the table has 2 parts. The first part, it contains the core subject competencies or outcome in the first part. So then if you open this volume and you go to ONG competencies and you scroll through the Obs and Gynae competency table, then you will see that in the first part, the Obs and Gynae core competencies are listed. In this, they have selected 38 topics from Obs and Gynae, and in each topic, they have subdivided into various learning outcomes. So after Obs and Gynae competencies finishes, the second part, in continuation, in addition, they have added or integrated the competencies from other allied subjects which are of relevance to our obstetrics and gynecology. Like suppose they have given a topic of labor. So they have chosen an allied competency from anatomy to describe the pelvis, or from physiology. So these competencies, they have listed under the heading of integration in continuation in this table. So it will be more clear if you just open the document and you see for yourself. So the second part of the same document will list the subject competencies which have been identified by expert as they are required for alignment or integration with the core subject. It can be from the previous phase, that is from the first phase, from anatomy, physiology, biochemistry, or from the higher phase. Now, as we can see that in this document, the topics and in obstetrics and gynecology, 38 essential topics have been chosen and they have been subdivided into the 126 competencies. Then The section 3, in section 3, they have chosen a few simple selected topics that run across the phase and that can be used for alignment and integration. Like suppose if we take a topic of anemia, it is a common topic which is common in phase 1, phase 2 and phase 3 across the physiology, biochemistry, in phase 2 pathology, in phase 3 medicine and gynecology. So they have just given an example that how we can design an AITO topic, that is aligned integrated topic. It can be either disease based like anemia, or it can be a system based like CVS or respiratory. So they have given just a few examples so as to make us understand how we can design our own AITOs, aligned integrated topics, when we are designing our curriculum, when we are designing our timetable. So these are the just suggestion, and they have given us freedom that we as a curriculum designer, or when we make a timetable, it is up to us that we can choose any topic and we can run it across the phase and form an aligned integrated topic. It can be aligned both in a horizontal integration in the same phase or in a vertical way across the phases. So it is very important that while we are designing curriculum, we keep in mind that we have to achieve all the broad competencies, and at the same time we have to retain subject-wise objective. We have to meet the subject-wise outcome, and when we have to align the subject competencies either from a previous phase or higher phase, that is when we have to align or we have to correlate or we have to nest from a higher phase with the aim to reduce the redundancy or duplication. At the same time, the subject emphasis on the main subject, it has to be continued. Still our assessment focus remains on the subject assessment. So this is how they have described the various competency in a table. This is just an example to make us understand that how we go about reading the competencies. Like we can see in this table, they have divided into various columns A, B, C, D, E, F, and so on. So under the column A, like competency, we can see that it is described, first it is PY 1.1. So this denotes the subject. PY is physiology and 1 is the topic. And under this topic, the 1.1 denotes the competency which is under this topic. So it can be second competency under the same topic. It will be 1.2, 1.3, 1.4, 1.5. So it depends on the number of sub-competencies that are there within the topic. Then second describes the description of competency. That is what we want to our learner to learn, and what we want, which competency we want the learner to achieve. Now, then the third column describes the domain. What does this competency assesses? Which domain? Whether it assesses the knowledge domain, skill domain, attitude domain, or communication domain. Then the next column, it identifies the level of Miller's pyramid that we want to it identifies the level of competency which is based on Miller's pyramid. Whether this tests the knows how level, skill level, shows how level, or perform level. Then the next column is whether this competency is a core competency. If yes, then it is given by. And then the suggested teaching learning method that has to be designed according to the competency, at which level we want to assess knowledge, skill, attitude. So accordingly, we have to design the teaching learning method, and based on the competency, the domain we want to assess, we have to design our assessment method based on the Miller's pyramid domain that we want to assess. Then H column, it describes the skill. It is basically the number of time we want a student to perform the skill to become proficient, and this can be maintained in a logbook. Basically, it is for the postgraduates, that is for the skill acquisition. Then the next I column, it describes the other allied subject with which we want to integrate the present subject. That is vertical integration with other phase, and if we want to integrate it within the subject of same phase, then the horizontal integration. So as ma'am has very well explained that about the designing of learning objectives from the competency, which will be doing a practice in our subsequent session. So this is basically we will learn how to design, how to break the competency into measurable learning objective. And this explains that suppose this is a competency from pathology, a competency 42.3. That is where we have to identify the etiology of meningitis based on given CSF parameters. So here what we want to assess is the knowledge domain and the skill domain, preferably by if we give some slide or want the student to identify under the microscope or and assess the shows how level, how he performs the skill level. So we have to break it into the learning objective based on the ABCD, that is audience, behavior, condition and degree, which I think we will elaborate it in our subsequent. That is audiences, that is whom we want to assess. We want to assess the phase 2 student for this pathology competency. And behavior is that what student should be able to do. That is, at the end of phase 2, student should be able to describe CSF parameter for a given etiology, and to what degree, that is, he should be able to tell correctly, he should be able to tell accurately. So these are the ABCDs that we will have to practice when we want to form the SLOs, when we have to break a competency into SLO. It might seem a bit complex, but once we do a practice, then it will come when we will do a practice session. So this domain we have ma'am has told, and it is also that we have to assess the we have to see which domain the competency is aimed at assessing: knowledge, skill, attitude and communication. Then based on the Miller's pyramid, what level of competency it is assessing: knows how, skill, shows how level, or perform level. Then competency, whether core, non-core, and then the suggested teaching learning method. So, and the last two columns, that is for alignment, as I had shown, from it can be from the previous phase or a subsequent phase vertical integration or horizontal integration from the same phase. So then from the competency based, we have to assess the knowledge domain, skill domain. Then accordingly we have to design the teaching learning session. If we want to test the knowledge domain, then we can plan lecture, small group discussion. And if we want to test the skill domain, then we can plan a practical session or skill in a skill or a small group discussion. So we have to design learning method accordingly. Then simultaneously with designing of teaching learning method, we have to design the assessment method. The knowledge domain, as ma'am has told, that we can take it in a test form, like we can ask for knowledge domain, write a short note or structured essay, and we can use various objective and verbs to test the higher analytical level of the knowledge. And if we want to test the skill domain, like suppose in this competency PA 42.3, that is in which the objective is that at the end of the session, the phase 2 student must be able to describe the CSF features for given etiology of meningitis accurately. So this is also basically a knowledge domain. So describe. So that can be given in a form of short note or a structured essay. while the last competency is that at the end of the session, phase 2 student must be able to identify etiology of meningitis correctly from given set of CSF parameters. So it can be taken, assessment can be done by making a skill station, by providing the CSF slide to the patient, or taking a biopsy. So it depends upon the domain of the knowledge we want to assess. So our teaching learning method and assessment has to be aligned with the domain of knowledge that we have to assess. And now coming to these are all the different learning objectives from microbiology. MI stand for microbiology, and topic they have chosen is anemia. And under anemia they have described they have formed various learning objectives. Now the thing is that these learning objectives which are from microbiology, the similar objective from pathology, they can be clubbed together and correlated, and so as to reduce redundancy and reduplication. And it can be, so these topic of microbiology, they can be aligned horizontally with pathology, or they can be integrated vertically with general medicine. So if you open that document, volume 3, and go to obstetric and gynecology section, it looks like this, that different topics are given, and under the topic, like in this first, it is given topic is demographic and vital statistics. So under this topic, they have given 3 competencies. OG topic 1, competency 1, 1.2, 1.3. And the domain you are assessing is knowledge domain, and the competency is knows how, and it is a core competency. And teaching learning method is, since it is a knowledge domain, it can the teaching learning can be through a lecture, small group discussion, and assessment can be through structured essay or short notes, and this can be aligned with community medicine as it is related to statistics and demography. So this can be aligned with community medicine from previous phase. So in this way, various competency topic wise have been listed, enumerated, approximately 38. And as you scroll it down, then next will come the heading integration, where they have given competency from community medicine, which is in common with statistics. So you can club together and reduce the redundancy. So just you open the document, although it might be seeming a bit complex at present, but if you just scroll through it and give few minutes, then it is not that difficult. So with this, I'll close my talk, and I will ask ma'am to add on her inputs.
So thank you, Shruti, for making that so clear to everybody. And I hope everybody will go through this document and what the important pages that Shruti has mentioned, and try to clarify how to use that document. So so next time when we meet after 1 week, we'll be ready to do the actual job, that is make the learning objectives. Dr. Amita, Dr. Sanjay Bedi. We are finishing well in time.
So, Dr. Tamkin, can I just come in?
Yeah.
Okay. So, first of all, we'll ask the participants whether they have any questions pertaining to whatever was talked about today. And yeah, that would be the first thing. I think we should ask them if they have anything.
Any queries, please put your hands.
Dr. Vaibhav Kanti.
Dr. Vaibhav, please go ahead. Please go ahead.
Vaibhav Kanti, Sonia, and Nagendra Prasad. 3 people have raised their hands.
Good evening, ma'am. Good evening, ma'am. This is Dr. Sonia. Ma'am, would you like to please tell a little about core, the definition of core competencies? Because I have heard this, I've come across this word very often in this lecture today. The core competence. What I understand with this is the essential competency which should be there in each student. Ma'am, can you please just guide me more about it?
Okay, so core competency is the must-know area. Like suppose you're going to take an exam, and you're going to put some questions to your undergraduate student, and you will have to judge whether you want to pass that student or you don't want to pass that student. So core competencies are going to help you in this way to think that if the student does not know this, the student does not qualify to get through. So I mean, this is what is meant by the core knowledge. Without that, you cannot build it upon it. In fact, there are certain domains of knowledge. So if you imagine a small circle, if you imagine a circle in which there is another circle and then there is another circle in it. So the core competency will be the innermost circle. Without that, the student does not pass. Beyond that, there will be another circle which says some nice to know areas, meaning that if this, now that the student has passed by telling you the core knowledge, by giving you an example of the core knowledge, you now have to start thinking how much a student has passed. So I'm already giving the student 5 out of 10. Now I'll ask some more difficult questions. So these are the nice to know areas. Now, if that student is able to answer those questions, then you raise the bar and give that student, let us say, a little more marks. So that is how we define core competencies and must know areas. So when you hear these two words, core competencies and must know areas, they mean the same thing. That is, these are the areas that a student should know, must know. Without that, the knowledge is incomplete. And then surrounding that will be areas which is good to know, nice to know. And there you start raising the standards become higher, the marks become higher, etc.
Can I just add that?
Yeah, please.
That is, you need to define whenever you are planning the competencies and going into the learning objectives, you must define what is the must know area, because most, and also how you divide your paper, your assessment system also, that about 60 to 70% of your paper, your assessment should include questions from the must know area or the core area, without which you are not going to allow that student to pass or to be able to practice. The nice to know area and the good to know area, they are those areas which help you in differentiating between the best student and the better student and the average student. So they are important. It is good that the student knows about them, but the core area or the must know area, the student doesn't know that. For example, for us, I would give you an example. If the student doesn't know how to manage eclampsia, how to manage a fit, that's a core area. You cannot allow that student to pass, isn't it? So that is a core area. So if he
Thank you
doesn't
so
know,
much. Thank you so much, ma'am, for describing so nicely.
Okay, that is the must know area. Can you just give further example of nice to know and to know the same eclampsia topic?
from the same topic. Okay. For example, if he doesn't know how to manage immediately eclampsia, that's a must-know area for pregnancy-induced hypertension, isn't it? But if that person doesn't know the latest markers which are being researched, maybe you will allow that student to pass, isn't it? What are the methods of predicting PIH in the first for an undergraduate? Not a must-know area, isn't it? Because you remember the ultimate goal. A person must provide basic care, immediate care, and refer the patient to a specialist. What an Indian medical graduate should be. Accordingly, we will decide. the must-know area, the good-to-know area, the nice-to-know areas. Okay.
Okay, Dr. Tambin, I'll just come in and clarify a little bit. Another way where you can define your core competency and non-core competency is by understanding the problem's gravity. Like let us suppose we know as obstetricians that every delivery can go into a PPH, and we know that obstetrical hemorrhage is a very important cause of maternal mortality. So we would like our undergraduates to know everything about managing a PPH. That would be the core competence. But if the person doesn't know a little bit about infertility, let us say, infertility probably might not endanger the life of the person concerned, but PPH definitely would. So another way of classifying your core competencies or identifying your core competencies, and as Supe sir had put, Avinash Supe sir had put, when defining these competencies, we took into account what are the pressing problems of the society. Where is it that we are lacking? Where our mothers are dying or having severe morbidity for that purpose? And that way, we could identify that yes, our undergraduate, who's let us say going to work both in the primary, secondary, and tertiary healthcare centers, they should be able to save lives. And that is how we can identify some core competence. That is one way. And the other way is, as Dr. Tamkin told you, that the essential knowledge for controlling an eclampsia or managing an eclampsia, again, eclampsia is sort of life-threatening. So managing an eclampsia is very important. But suppose you do not know what are the markers, or you cannot, the person cannot tell you what are the predictors of eclampsia. Maybe you will give him a little leeway. So that there are the two ways how we should be able to identify our core competence. Is it okay? I mean, is that part clear?
If you remember that slide on how do we decide what are the learning objectives, if you remember those 4 important things, like Dr. Amita said, the importance from the point of view or morbidity and mortality that a disease causes, then on the job requirements, isn't it? That is a core area, because maybe it is not causing mortality, pelvic inflammatory disease, but we need to see so many patients of. So it is a core area. Every student should know about pelvic inflammatory disease, and because of the long-term effects it causes, the infertility that it causes. And then maybe the case fertility rate is so high for amniotic fluid embolism. That is why, though it is not so common, but still it is a core area that they should know the immediate management of amniotic fluid embolism.
Okay. Another thing we would like our participants to know that knowingly or unknowingly, this discussion has led to a very important point that is called blueprinting. And it is in this blueprinting we take into account what are the common problems encountered and what are the life-threatening problems that are encountered in each subject. And that is how we decide what to include in our curriculum, both for competencies, for teaching, learning, and for assessment. And maybe because I think now that this has come up, maybe as we finish, as we keep doing our sessions, we'll keep a session on blueprinting for OB. Bedi sir, what do you think?
Assessment, yeah, the assessment part.
Bedi sir, what do you think about that? Are you there, Bedi sir, with us?
Definitely, Dr. Amita, the assessment session should include blueprinting.
Yeah, so we'll talk about blueprinting,
Yes.
or maybe we'll make a session on blueprinting separately, because assessment per se is huge, as is every other topic. So maybe we'll keep a blueprinting session if the participants so desire.
Yeah, definitely, it's very important.
Each batch has spoken on blueprinting as applied to their subject. So I think the same tradition can be continued in OB-GYN also.
Yeah.
Right. We could do that.
Yeah.
We could do that.
Yes.
So any more suggestions? Any more suggestions from the participants? You can put it on the
few hands. Dr. Shikha said.
Good evening, Dr.
Yes,
Shekhar.
please. Please, yes. Please go ahead with your question,
Please
Dr.
speak,
Shekhar.
Dr.
We are
Shekhar.
listening.
We can't hear you. There is some problem in your mic. It seems.
So you can put the question on the
Dr.
WhatsApp.
Pushpa Jungari. Yes, you can type your question on the WhatsApp or chat. Dr. Madhav Prasad. Dr. Nishu
Yeah,
Priya.
there was this discussion about core competencies and non-core competencies. I understand that the 3 volumes which are provided by the MCA has already identified which is core and non-core.
Definitely, that is true. Absolutely true. Absolutely, absolutely. Yes. Dr. Madhav, this is absolutely true, and that is why I mean, it has brought about a lot of uniformity in the sense that we all know what are the core areas that has to be taught, because everybody will otherwise have a different opinion as to what is the core area. So it's good that the expert team has given us the core area, and you're absolutely right that the core areas have been defined.
So ma'am,
Yes.
while designing teaching learning methods,
Yes.
is it going to be actually the question is, are we going to focus less regarding assessment of the non-core areas, or is it going to impact our teaching learning methods? That's what I want to know.
When we talk about the competency, the alignment of the teaching learning and the assessment will have to be done with the competency, whether they are core or non-core. And of course, as the NMC has given this document, the core areas will have to be covered in the sense that the competencies will have to be dealt with, the teaching learning will have to be done, and the assessment will also have to be done. But the non-core areas will be as per your feasibility, because you see, we are different medical colleges, we have different number of staff, we have different number of resources. So it might not be possible for every competency to be covered that way, but the core competency should be covered for every college. And if you are lucky enough to have a lot of resources as well as a lot of time, because now again the time is of constraints. COVID has caused us to lose a lot of teaching time. So if you have the time and the resources, you of course will be able to cover some non-core areas as well. But core areas have to be covered. And when we talk about the logbook, which we are going to talk about subsequently, it emphasizes that the logbook competencies should be the core competencies and not the non-core.
Basically, that is the purpose of blueprinting. I would just like to add that this is the basic purpose of blueprinting, that you divide the assessment according to the stage that you give to a particular area. Depends on whether it's a core area or a non-core area. And you do need to include the non-core areas as well, because you should be able to differentiate the evidence. So please, can you all mute yourselves once you have stopped? So I hope it answers.
Can I just
yeah.
Dr. Madhav, have we been able to answer your question, please? Dr. Madhav?
Yes, madam. Yes. Thank you.
Okay,
So
thank
it should include all areas. Only the weightage has to be different.
I'm Dr. Malti. Can I just add one point?
Dr.
Malti,
I would request all the participants to mute their mic.
Dr. Malti, please go ahead.
Yeah, thank you so much. When I went through this competency book, I had seen that only 4, to my knowledge, only 4 subjects are like coming under the non-core competencies, 4 competencies only.
Exactly.
But very recently, I had Rajiv Gandhi University of House, where 4 to 5 questions have come from this non-core. So, Just 4 to 5 questions have been picked up from these non-core competencies.
I'm not able to get what you were saying. Please, can you repeat? There's so much disturbance.
Yeah. There are 4 to 5 non-core competencies mentioned in this volume.
Dr. Sanjay, can you just, mute all these people?
I'm muting. Dr. Malti, please unmute yourself again.
Yeah, thank you so much. What I have noticed is there are only 3 to 4 non-core competencies in this volume. And very recently, I had corrected the papers from one of the universities, Rajiv Gandhi. There were 4 questions from these non-core. There was one question on management of VBF, which is a non-core mentioned in this volume. And another question was on describing the various Mullerian anomalies. I don't know, there are 3 to 4 questions which have come up from this non-core. So is that okay? Why is this allowed?
Can I answer that question?
Dr. Sanjay, okay.
Can I answer that question?
Okay. This is why we are having all this discussion. This is why we are having this session, that we don't, repeat these mistakes. Don't repeat these mistakes. Why we should have a blueprint? Because then the whole process of assessment becomes, it becomes a joke. If you're giving 4 questions to an undergraduate, out of 5 questions, 4 are from the non-core area. And that is why we should all familiarize ourselves with all this basics of medical education.
See, can I just come in on this?
Yes, ma'am.
Okay. So, as you heard on the keynote address by Avinash Rupe sir, you would have known that I just put a slide there saying that thankfully the core competencies has been defined for us, because that is what needs to be there to bring about uniformity in the whole of India. Since the core competencies have been defined, I expect now, and we all expect, that universities will not give out such questions which come from areas which are non-core, but focus on questions which are core competence. But that, of course, remains to be seen.
Madam, we all know when something is done wrong. So let us not hamper on this. Move forward.
Absolutely.
They might have made some mistake. Maybe they will realize it and they will not do.
Right. Right. We'll keep our fingers crossed.
May I join the conversation?
I can relate one incident. One of my senior teachers used to give all questions from a very, non-core areas. And she used to say that the important topics hai, the students will bring, kharre or whatever, notes with them. So I don't want them to cheat. And that is why I'm giving these, just so there. So maybe some people have different reasons. That is not the answer to the problem. So any more questions? Can we just now? 1.5 hours already. Dr. Sanjay?
Yes. I'm lowering everyone's hands. So if anybody still wants to ask a question, please raise them again. Okay, Doctor.
Questions on the group.
Anurag wants to ask a question.
Good evening, ma'am. Good evening, ma'am. I am from Himachal Pradesh, district Hamirpur, Himachal Pradesh. Our is a new medical college. We are taking just 30th admission, and I just want to know are we late to submit the LOs to the MCI? And I am heading the department. I am working as an assistant professor in the Department of Obstetrics and Gynaecology, and there are no assistant professor over me.
So much disturbance, I'm not able to follow.
Our new medical college, we are having just now we have our third year batch. We started our college in 2018. We have just admitted third year batch.
Yeah.
Are we late to submit the learning objectives?
Actually, the last year May we were supposed to submit all those learning objectives and upload it on the website. But most of the medical colleges have done it. Some are remaining still. So there's still time we can start doing it.
So I will be able to finish the same in the this webinar or so this course. Will I be able to submit it in time during this course?
I think so. We'll help you do that.
Sorry, ma'am?
I think we'll be able to help you do that.
Okay, thank you, ma'am. Thank you.
Because that is the group activity we have planned. Dr. Sanjay.
So I think we can end it.
Dr. Sanjay, we are not able to have any discussion. Can we just, because of so much background noise, I don't know, people have not muted themselves. So can we just carry on the rest of the questions on the group?
Yes, the rest of the questions will be on WhatsApp group.
Yeah.
And it's already 8:35, so families must be complaining for dinner. So
Thank you
I
so
think
much,
we can end.
For such an interactive session, and Dr. Amita and Dr. Sanjay. Thank you so much, Dr. Suchi. So we meet next Saturday.
Okay.